Once the avascular plane is found, dissection is extended anteriorly. The dissection should occur along the peritoneal sheet, aiming to identify and preserve the autonomic nerves belonging to the inferior hypogastric plexus. By keeping the dissection medial to the hypogastric plexus, it is deepened until the upper surface of the tumour is exposed. The posterolateral aspect is progressively dissected. The likely vascular pedicle of the tumour is identified. Lateral release of the tumour is performed along its capsule to ensure the preservation of the right sacral roots. The nutrient pedicle of the tumour is addressed through progressive cauterization. Despite hemostatic precautions, localized bleeding is observed, which is contained through compression using gauze through the auxiliary arm. It may be noted that despite the cauterization precautions, the release of the pedicle progressed with difficulty due to its anatomical location with challenging access, confirming literature reports of significant bleeding during sacral schwannoma resection. Finally, the tumour is completely released, removed from the pelvic cavity,